Thanks so much for joining us today, Dr. Pate.
Thanks for having me.
I'm really excited to have this chat because you happen to be the medical director for two of my favorite organizations, Heroic Hearts Project and Unlimited Sciences. I learned of them independently, and I love that there's so much collaboration in this psychedelic space, and you are a big part of a lot of what is driving the research. So I am stoked to have this conversation, and also because veterans are near and dear to my heart. So if you could tell us a little bit about how you got into studying traumatic brain injury and other neurologic conditions.
Yeah, absolutely. This has been an ongoing thing for me. I mean, it's something I've been fascinated with the brain ever since I was a little kid. I mean, I just always wanted to understand it and learn about it. And when I was going through grad school, so my PhD is in neurophysiology, and I primarily focused on the respiratory system, so kind of the brain breath body connection. But because of my interest in neuroscience in general, I started to see how even with brain injury, the respiratory system could start to experience some dysfunction. And then that took me in this whole other arena of just traumatic brain injury in general and this fascination with what goes on, because at the time there's really not a lot known, and there's still quite a bit that we don't know about it. But since 2006 or whatever, I mean, there's been a significant leaps and bounds in what we do know. But it was such a fascinating thing to understand, well, what is going on, and how does that manifest in these really drastic changes behaviorally, but also for the individual, like symptomatically, and like what could we actually do about it? There's got to be something that we can do. Even if you don't understand the full mechanism, there are things that we can explore to try to understand this. And on top of that, I come from a family of active children, and my brothers they used to race motocross, and they've had their fair share of concussions. And I rode horses growing up, and had my fair share as well. And just understanding this on a very personal level, maybe to try to help myself or to help them. And also, I think there was this curiosity around, how does this lead to long-term neurodegeneration and maybe a manifestation of something like what we see as Alzheimer's disease? And how do we prevent somebody from who's out there active, living their lives? How do we prevent them from getting to that place just from some tragic injury? And over the years, but two of my brothers ended up serving in the military, and I started to understand more about traumatic brain injury from that aspect. And I started to understand how our service members, men and women, are experiencing traumatic brain injuries at a much higher rate than the general population. And part of it's from blast trauma, of course, with the global war on terror. But even without the blast trauma, there's blunt trauma injuries even during training. And there's an occupational hazard of being in the military that predisposes people to injury, and trying to understand it from that perspective as well. Especially when you hear all these stories about people who are, getting out of the military and transitioning, and as veterans dealing with the fallout from significant traumatic brain injuries over the years, and really feeling completely alone and without options. Especially when we look towards the VA, it was very traditional in their approach to care, and for good reason. That just many people didn't feel like there were effective options for them, and the symptoms that they were experiencing as a result of their traumatic brain injury. So it's really been an evolving interest and passion for me. And I think even more recently, the understanding of how mental health is related to traumatic brain injury, and how do we address that too in the whole mix of everything, has been kind of the latest evolving part of the passion for me.
Yeah, I wanted to ask you about that because a lot of the symptoms of what we may think are post-traumatic stress related are actually TBI symptoms, traumatic brain injury symptoms. Can you talk a little bit about that overlap and why that can lead to some confusion?
Absolutely. Yeah. The two, so traumatic brain injury can lead to so many different symptoms that people experience, from changes in mood, so mood disorders, changes in cognition, the ability to focus, the ability to remember things. And as far as like self-regulation goes, the ability to not be impulsive. It also can lead to sleep disturbances and stress reactivity. And when you think about post-traumatic stress disorder, a lot of what people experience as symptoms of that are related. So they have problems with irritability, they have problems with memory and cognition, they have problems sleeping, they're hyper reactive. All of these things that we talk about are very similar to both. And now they have symptoms that are different, but these main ones are very common in both cases. Additionally, traumatic brain injury can predispose folks for going on to develop PTSD. So you may have both. You may have a history of traumatic brain injury, and because of what the injury was to your brain, and then this outcome that is, the secondary damage and inflammation and all of those things that occur following a head injury, that can predispose and make it more likely that somebody goes on to develop PTSD following trauma in the future. So it almost primes people for that. And so when people are experiencing these types of symptoms, they really need to take a thorough look into their health history and really try to remember, did I have a head injury? And, have I had multiple head injuries? Was there a traumatic event in my past? Really just trying to comb through it with a fine-tooth comb, because it can be confusing for folks. And to make things harder, these symptoms can develop way later, way into the future from when either the TBI or the trauma happened. So it's really hard to differentiate sometimes. But with a good health practitioner, as a good partnership between an individual and their healthcare provider, they can kind of get to the bottom of these things.
Yeah, I was going to ask, is a good first start to go to your, neurologist, let's say primary care, you've already gone to them, but you go to your neurologist, is the neurologist able to tease out a little bit of, yes, there's the history, but with a physical exam, are there some differences that they can tease out in there?
That's a great question. I don't know upon just a physical exam that they would really be able to tease out the differences. I think it really is going to stem more from the detailed medical history. And, unfortunately, a lot of people struggle with even remembering, the events when they happened. So that's something else that is, difficult to consider when talking about healing. And there are some treatments that benefit both. So I think the way that people can go about it is, if they don't know which it might be, is to start trying to work through treating both. One, first, healing the brain in whatever capacity you can. And the second is dealing with potentially there may be a trauma there, and multiple traumas even. And how do you work through that with, the multi-pronged approach of therapy, psychotherapy, and alternative treatments as well, to help reset and rewire your nervous system in a healthy way. So I think healing the brain is the first thing that you have to do, because if you try to address the rewiring of an unhealthy brain, you're going to have an uphill battle. So the first thing that you should probably do is just focus on healing the brain. And then when that, in conjunction, as that's ongoing, rewiring it in a positive way.
Yeah, I appreciate that perspective, because I can imagine there are a lot of people out there with post-traumatic stress issues that have tried all of like the psychotherapy and things that are focused just in that area, and they're not improving because, like you said, the brain still has effects from the TBI lingering. And so hopefully this gives people some hope because so many people, like you said, especially our veterans, have experienced both.
Yes.
It's like, so many concussions, even just if you haven't gone anywhere, but let's deploy them on top of that. And then you may have some post-traumatic stress issues. Or, there's post-traumatic stress you could have from still being here in the States. You don't even have to be deployed. So there's so frequently that those are coexisting in the same individual. So anybody out there, I love that description. Thank you, Dr. Pate, for describing how, if you think it's PTSD and things aren't working, maybe it's because we've got to heal some other things first. So hopefully that gives people some hope. Let's get into psychedelics for TBI. Let's talk a little bit, because we're going to have another episode on psychedelics for PTSD. But I wanted to talk a little bit about your experience and your research and what you've been working with in regards to ayahuasca and how that can be helpful in a TBI situation.
Absolutely. Yeah. it's a really, it's interesting. We're learning more about it, and for those listening, I'm sure many know, but for those who don't, there are two main components. I mean, there's so many bioactive compounds in the ayahuasca brew, but generally we refer to the DMT, of course, and the alkaloids, the Harmala alkaloids, harmine, tetrahydroharmine, and harmaline, which those are the three main ones, but there are many other beta carboline alkaloids in the brew that have effects that most people overlook because they think primarily the DMT is, doing all the work, which is understandable because it has profound effects in and of itself. But these Harmala alkaloids are partly what's responsible for making the DMT available. So they're the monoamine oxidase inhibitors, and they have powerful effects on not reversing, but dampening depression. So for folks who are in major depressive disorder or treatment-resistant depression, these alkaloids in and of themselves can have effects. And so without the psychedelic experience. And so that's something for people to keep in mind, that it is this kind of holistic approach to healing. It's not just about the psychedelic experience that is in and of itself healing. So I think with ayahuasca, you have the DMT and you have these other compounds, which are having effects at the cellular level. And when I say that, I think that as a whole, when the DMT actually does get into the body and is able to exert its effects, it acts on the serotonergic system. And the serotonergic system, when activated, is typically actually pro-inflammatory. But what we're seeing with ayahuasca and other psychedelics that are acting on the serotonin system is that they're actually promoting an anti-inflammatory profile in the body, which is extremely important, especially in the case of traumatic brain injury, because when you have some sort of neurotrauma, you have the initial insult that causes damage, but then you have this inflammatory cascade that occurs afterwards when you have cell recruitment and inflammatory cytokines and chemokines and all these kinds that are released and cause this massive inflammatory response, and that can cause further neural damage. And so you want to stop that cycle at some point. And some inflammation is good for managing the initial damage, but you want to stop that before it gets out of hand. And so psychedelics, especially acting on the serotonergic system, have the ability to promote this anti-inflammatory state, both in the brain and as in the body as a whole, which is extremely important for providing potential healing. Additionally, I think that the serotonergic system, of course, with the psychedelic effect, there is this profound healing in the individual. So there's the decrease in overall stress in an individual following these experiences, which again, stress in and of itself can be quite toxic to the body. That we know that these traumatic experiences and injuries even cause this massive release in catecholamines like epinephrine and norepinephrine. And that massive release in the body actually does lead to inflammation over time. And so again, these compounds have the ability to suppress some of that inflammation. And another thing that's really interesting when we talk about traumatic brain injury is that it seems completely unrelated, but the gut actually is extremely important in both promoting the pathogenesis of traumatic brain injury, but also, you can use that to prevent worse outcomes. And so the way that this works is that if you have trauma to the head, the inflammation that is experienced is able to signal to the gut through the vagus nerve, which the gut is highly innervated. And people often refer to it as the second brain because there's so much innervation, but the vagus nerve can signal to the gut, the enteric nervous system, that there's inflammation. And that signaling to the gut actually has the ability to change the profile of the bacteria in the gut. There's a lot of research around shifts in the gut microbiome following head trauma, following traumatic brain injury. And what happens is the gut bacteria are shifting towards a profile that is a pro-inflammatory profile. And so that essential shift causes further release of inflammatory cytokines, and that gets sent back to the brain, and it's this positive feedback loop that unfortunately persists. And so if psychedelics are able to get on board and act in the brain to shut down that inflammation, it also can hopefully prevent that bidirectional pathway to the gut from being pro-inflammatory. And the beautiful thing about ayahuasca is that consuming this brew, the Harmala alkaloids actually have a profound effect on the gut microbiome in and of themselves. And so the brew, just by drinking it and acting on the gut itself, can shut down inflammation and promote a anti-inflammatory profile. And this is the theory that we're exploring at Heroic Hearts Project. We've pieced the research together to understand that this is possible and likely what's going on, but we're trying to explore that in a systematic way. And so these serotonergic psychedelics have the ability to affect inflammation, which has profound effects on traumatic brain injury. Outside of that, we are also starting to understand how these substances also, and these plant medicines and entheogens, are able to promote neuroplasticity. So it's essentially the rewiring of the brain cells that you already have. And DMT absolutely does that. And you and I were just chatting about some other serotonergic psychedelics as well that may have similar capabilities, like psilocybin and LSD, to promote plasticity in the nervous system by shifting how things are connected and promoting more, outgrowth of receptors, or maybe potentially more dendrites on neurons to increase the number of conversations, if you will, that they can have between themselves and other neurons. So that's really incredible. And that happens through the serotonin system and the ability of these plant medicines to activate this compound called brain-derived neurotrophic factor, or BDNF. And that's really profound and well documented as well. And then ayahuasca, on top of it, these alkaloids have the ability to promote neurogenesis, which is the growth of new neurons. And this happens in the area where we have stem cells in the hippocampus. And this has been shown in vitro with adult neural stem cells, and they're able to proliferate and migrate and differentiate into adult neurons and other supporting cells that you would find in nervous system tissue. So this is huge. And when we talk about traumatic brain injury, and for folks who have, sustained numerous injuries over the years and potentially have some neurodegeneration, this could be really potentially life-saving for some people.
Wow. Thank you for all that. That is so much good information. I love hearing about the BDNF. So is it that all the serotonergic plant and molecular, let's say, are through that 5-HT2A receptor, they're leading to more BDNF, and that's what's leading to this, as you called it, and I learned a new word, neurotogenesis, which is the dendrites and the more communication. Is that the same method for all those?
Yeah, I think that there are many pathways that we're starting to understand and explore. I think there's also, these compounds can have effects on cell signaling in a variety of ways. And I think this is just one. This is one that we know about. And there are other ways they can activate sigma-1 receptors, and they can activate all these other types of receptors and cause these other cellular responses that we're starting to understand. But it seems like they're all leading to positive effects, that there's not a detrimental outcome from this. It's not like it's promoting, cell death and inflammation. It's the total opposite. All of the benefits that you would want to see to compensate for injury. And so I think that to your question, the serotonergic psychedelics that act on the serotonin system do have an effect in this way through BDNF. And there may be many others that we still haven't yet found.
Yeah, and you had talked about how it's the HARMA alkaloids that are leading to neurogenesis in the studies that have been done on ayahuasca. And we were talking beforehand about how they have found that psilocybin can also have that neurogenesis effect on those hippocampal cells, but that would make it think that it was the DMT. So can you talk a little bit about the alkaloids, like where are they found? And you had talked about at the beginning, you don't necessarily have to have a psychedelic experience. Is there a place that anybody is just giving these alkaloids, and like in the studies they were just given the alkaloids and that's how they found?
Hmm. Yeah, and they in some studies they've combined them, so they had an actual ayahuasca brew, and then others they separated them out. And so, I think that's the giant question. It is an unknown. Like, what is going on? How is how are all of these things working? And when they're together in the ayahuasca brew, there's synergistic effects potentially, and what does that look like? And so yeah, I don't know. I don't know a good answer to that other than I think that there's so much that we're understanding about all of the different compounds that could have potential beneficial effects. But for research, it requires a lot of investigation, and there's a lot of compounds in ayahuasca in particular that we don't know about or haven't explored systematically yet that could also be having really large effects. So when you have something that's kind of a plant-based, botanical, if you will, it's harder to know what's having the most profound effect. Whereas if you have something that's isolated like psilocybin or like LSD, or just DMT in and of itself, it's a little easier to understand what's going on. And so ayahuasca does become this mystery sometimes.
Yeah, I can imagine. And I realize maybe at this point we should have, and probably at the beginning, but let's rewind. And for those who don't necessarily understand the mechanism, if you have a traumatic brain injury, like you said, there's a lot of inflammation, but there can also be actual dying off of segments of the brain, correct?
Yeah. Yes, exactly.
And so that's why we're talking about how important it could be to have neurogenesis, which is growing new parts of the new neurons, and then also neuroplasticity, because if you've lost parts of your brain and then your brain has just learned to communicate with what's left, then it's important that while you're growing those, perhaps growing new sections back, that there's also new pathways and new communication forming. And that's why the neuroplasticity is important, correct?
Exactly. Yeah. And this is why, this is also why when people have these experiences on psychedelics, that when they're essentially giving themselves an opportunity to rewire the brain in a healthy way. And when you have an experience with any of them, it's really important afterwards to choose activities to build healthy habits, to choose activities that are good for you, to hopefully set up positive habits, positive pathways that are promoting health. And, if you have an experience and your brain is sort of, plastic and ready to be molded into whatever pattern you choose, you don't want to make poor choices that lead to unhealthy behaviors and bad habits right afterwards. So you're kind of giving yourself a clean slate to develop some really healthy patterns, and that's what you want to capitalize on. Whether you have a TBI or PTSD or neither of those things, but something else, it's really giving you an opportunity to help yourself in the most effective way possible. So that time point afterwards is, as you brought up, is it's a very good point, is it's very important to mold your brain into choosing positive pathways.
I'm so glad you brought that up. That's absolutely crucial. This is not a magic pill or a magic brew. It's just the beginning of it's a tool in the journey, but it has to be helped. Like I think it was Jim Fadiman saying, like, okay, you've got this bike that's been in this deep muddy rut this whole time, and like you have to jump out of that rut, and make a new one, but that rut is still there. You could still fall back into it. Like we need to keep supportive with whatever integration practices, or like you just said, healthy habits overall that support that new pathway that you're digging out. So thank you for bringing up that. One more thing I would love to ask you is that I know we're talking mostly about what's been done, but so much of, this new industry is that before things get to the trial, there's a lot of anecdotal evidence that leads two things being studied. So if you could just talk about a little bit of the other compounds that you have found anecdotally helping people with traumatic brain injury.
Yeah, I think so. Certainly, I think ayahuasca, from a scientific standpoint, from what we know about it and what I've seen in people who have experienced TBI and experienced ayahuasca, it seems to be great benefit there. But also, I have heard, and this is primarily among the veteran community. So I don't have as much information for others who have experienced different types of TBI, rather than primarily blast trauma in the military. But for at least for a group of individuals that I know who have experienced pretty severe blast trauma. These are breachers and people who have been in, near lots of explosions and high explosive weaponry for many, many years. Also probably played football and, all the other things, right, that happened prior. But psilocybin has been effective for many. I've also heard that ibogaine has been effective for folks as well. And it is effective when I say that, it's effective in addressing the symptoms of TBI. So I don't know what their brains look like. I don't know what they looked like before or after. I have no idea if there have been any changes or new neural growth or any of that. I would assume there's a lot of plasticity going on. But even that aside, not knowing that for sure, the symptoms have gone away. And what the major ones I would say that I've seen and heard and had people say that they've experienced immediate effects with regard to cognition and ability to focus, ability to remember, ability to emotionally regulate as well. Before they might have been like a kind of a slave to emotions and up and down and highly reactive. And there seems to have been a little bit of a reset there as well. General mood and outlook on life, before just again, irritable and lots of depression associated with TBI as well. And some of these folks also had been diagnosed with PTSD, and whether that was real or not, we don't know. It could have just been their TBIs, but these are the debilitating symptoms that people often experience following TBI. So the fact that one potential dose of ibogaine or one macro dose or, not a hero dose, but just a very perceptible dose of psilocybin has been effective as well. So, and it seems that it's effective for a very long period of time. And these people have also kind of found their way back to the medicine. And it may be for other reasons than just addressing symptoms. It may be more of a spiritual quest at that point, for some of them. So, I wouldn't say that the effects wore off necessarily, but maybe they're trying to address the next layer, if you will.
Yeah. Oh, I really appreciate you adding that, because I think that's the question. If you see somebody that's been quote unquote healed by one of these, medicines, and they've got this, and then if they ever claim they've gone back, is it because it failed? No. I mean, that is always an option. Yes. But there's always that second level is like TBI wasn't the only thing in their life.
Right.
There's so many other things they may want to address, their self-perception or confidence or what, relationship with parents, so many other things that they could be going back for. And so thank you for bringing that up. And for all of this wisdom that you shared, can you tell people where to find you, and then also where to find these lovely organizations that you work with these days?
Absolutely. So Heroic Hearts Project, you can look them up. It's just heroicheartsproject.org. And they're really focused on helping veterans in any way that they possibly can. Unlimited Sciences as well, unlimitedSciences.org, doing research with Johns Hopkins and hopefully expanding that into other arenas in the future, potentially with TBI. So those are the two organizations. And then for me, you can find me, probably the easiest way is Instagram. I'm Doc Pate, dot Pate. Yeah. And if you want to reach me via email and just ask questions or find out more about these organizations, it's kate.pate@heroicheartsproject.org.
Awesome. Thank you for that. I always just I'm so touched when people give their emails, because that's just this, like I said, this community, like everybody wants to help and be reachable. So thank you for all of your information and for coming on, and for everybody else, until next time.